My name is Gillian and I'm a psychosynthesis counsellor. And many years ago, when my children were very small, I decided to do an Open University degree course and finally got my degree in psychology. And I was very proud of that, but thought to myself, well, what am I going to do with this degree now? And realised that I'd always been the sort of person that people came to. I'm good at listening, good at, for people to come and tell me their troubles. So it seemed very natural to me to want to go into counselling. But I think what a lot of people don't realise is that there are many types of counselling. So obviously I had to choose one that I liked. And I went to a course one day in London, in Tooley Street, for psychosynthesis counselling, which is a bit of a mouthful. But I went to a basic introduction day and found that I actually really liked the sound of this type of counselling. Because I guess if you think of the word psychosynthesis and you break it down, psych or psyche is to do with the essence of who we are. Sometimes it's called our soul, or sometimes applies to our mind, but it's basically the essence of who we are. And synthesis is a bringing together, a making whole. So this really made sense to me when I was listening to it. I have worked with clients for about 7 years now. I trained in the Psychosynthesis and Education Trust in London for 3 years, gained a postgraduate diploma in psychosynthesis for counselling, and I've worked counselling, seeing clients for about 7 years now since I qualified. I have done some voluntary counselling. I have worked for the Portsmouth Counselling Service. That was my original training place, my placement, where I actually got to see all sorts of people with all sorts of problems. I suppose if you want to know what I specialise in, I guess the speciality is about psychosynthesis, but I don't actually specialise in one particular area. I see people with all sorts of problems. And that could be anything from childhood abuse, that's emotional, physical or sexual abuse. I've also seen people who've suffered with depression and anxiety. I've seen people who've gone through a loss, through bereavement or divorce. And I've also talked with people about relationship problems as well. And a lot more. So I am sort of an all-rounder really in that respect. I love the work I do. I love the fact that I connect with people on a deeper level. And I think that's a real privilege to be able to do that, actually. I've also trained just basically in CBT, which is cognitive behavioural therapy. That's a different approach than psychosynthesis. CBT is about our thought processes and our behaviour. And I think that's quite unique, and I sometimes integrate that in with psychosynthesis if I feel that it's called for with a client. Some people worry and get really anxious and their thought processes just go round and round and round and they can't seem to switch their thoughts off. And usually those kinds of thoughts can be very negative. CBT is about learning to see things differently, to change our thought patterns. And when our thought patterns change, our behaviour changes and our feelings change because they're all interconnected. So CBT is very, very useful, especially with people who suffer with depression or phobias or social anxiety. All these sorts of things are very useful with CBT. So I guess that's basically what I do.